Good morning, everyone. Can everyone in the back hear? Okay, excellent. Well, welcome. My name is Josh Sommer. I am the co-founder and executive director of the Chordoma Foundation. It's so good to see a lot of familiar faces here in the audience, and really nice to see quite a number of new faces as well. By way of background, for those who I haven't yet met, I'm an 11-year survivor of chordoma. I was diagnosed at the age of 18 back in 2006 when I was an undergrad at Duke. And just being here today is such an exciting moment because things have really changed so much in the last 10 years. I was just having an opportunity to catch up with Dr. DeMonte, who it's hard to believe actually came to the Chordoma Foundation's very first international research workshop in 2007. And to see the progress in the field of chordoma research, to see how the patient community has coalesced and grown over that time, to see how the field of chordoma treatment has changed, it's really been an exciting journey. And I'm so happy that all of you are here today to be a part of that. I think you'll see we have a terrific lineup of both basic researchers as well as an incredible lineup of clinical faculty here at MD Anderson. There really are not many centers in the country that have such strength in so many different areas, and so we are really honored and delighted to partner with MD Anderson and all the faculty here to put on this event. I think that my hope for today is really that is threefold. First of all, as I said, the lineup is really remarkable, and I hope that everyone walks away learning something valuable. There is such a wealth of knowledge to be gained and so many new treatment approaches and so much happening in research that I hope that this proves to be an educational event. I also hope that it provides an opportunity to form some lasting connections. I think for all of us who have been through chordoma, there are certainly ups and downs and many challenges that come with dealing with this disease, but I think that it's true for many of us that there is strength in numbers and a great deal to be gained by connecting with others who have been through a similar journey. And so I hope that today might spark some new relationships that could persist even after the conference. And finally, I hope that you leave today inspired by the progress that's happening and by the sense of possibility. I think that over the last 10 years, the way that this field has unfolded and the way that research has progressed, there are so many opportunities right now. The field is moving so quickly, and I personally feel just incredibly boosting sense of hope from the progress that's being made. And so I hope that each of you is left with a small sense of that as well. So without further ado, I want to make some thank yous to the people who have made today possible, in particular to the Chordoma Foundation staff, Shannon and Megan on our team, who have done an extraordinary job pulling this together. I also want to thank a number of individuals here at MD Anderson, Crystal Jackson in the neurosurgery department, who has done really a yeoman's job of organizing. I want to thank all the faculty who are on the agenda today, who have many of whom have been partners of the Chordoma Foundation for many years now, and who are giving of their time on a Saturday. It's really a remarkable testament to the dedication that each of them has to this disease and to being a part of this community and this movement. And in particular, I want to recognize and thank Dr. Shaan Raza, who is really the engine behind the event that is going to unfold today. Dr. Raza has been absolutely a tremendous partner in organizing this conference, in envisioning it. So we owe you a large debt of gratitude. Dr. Raza is a member of the skull-based tumor program here at MD Anderson. He is an assistant professor in neurosurgery and head and neck surgery, and one of the country's leaders in skull-based surgery and the treatment of chordoma. So Dr. Raza is going to be our MC for today and the moderator of the first session. So without further ado, Dr. Raza, it's really a pleasure.
Well, just on behalf of all the MD Anderson faculty, I just want to thank all the patients and caregivers for coming today on a Saturday. If this is your first time in Houston, the Texas Medical Center is a pretty impressive facility. I just moved here 4 years ago, and I think it's one of the coolest places on earth. This is an aerial view. You can see downtown Houston circled in the background, and the foreground is the entire Texas Medical Center. And so there's a wealth of expertise in the medical centers I'm discovering, and the fun part sort of put everything together as all the patients have realized. As Josh mentioned, doing something like this really requires a lot of help, and so I do want to thank Crystal from our office and Shannon and Megan from the Chordoma Foundation to making sure that we stay on track, that we cover all the important points that I think are relevant to all the patients and caregivers, and so I think they've helped us do that. And of course, I want to thank Josh from the Chordoma Foundation. I think as all the clinicians at MD Anderson will recognize, that this is one of the most impressive patient support groups or disease-centric groups that we've ever worked with. It definitely is a pleasure, partnering with them to help take care of our patients. And I find that the patients I take care of that have come through the Chordoma Foundation are the most well-informed patients, and I think that definitely elevates the quality of their care when you can have a high-level conversation in clinic and patients know what to expect in the long run. And conferences like this require financial support, and so we definitely appreciate the generous grants we've gotten from our industry partners to make sure that something like this can happen. Now, this is a list of all the faculty we have included today, and so we've tried to hit all the major subject points that are relevant to patients and caregivers, everything from initial treatment to management of recurrent disease to long-term expectations, and even sort of navigating the insurance landscape. And so that's what you'll see reflected in the agenda today. On one hand, you can view this as sort of a day-long seminar with a bunch of lectures, but as many of you know, clinicians can sort of talk a lot. So what I've done is sort of limit the presentations to 10 minutes. And what I want you to do is take advantage of the question and answer sessions and the breakouts and the breaks to sort of approach the speakers and ask questions, because oftentimes in a rushed clinic appointment, when you're running late for another appointment, you don't have that opportunity to ask questions that you wanted to ask. And so take advantage of that opportunity. So we're going to start out by talking about sort of the current clinical treatments for chordoma. Then we're going to move on to an Ask the Experts panel. And then in the afternoon, we have breakout sessions with the social workers. And fortunately, we have our nurse practitioners from neurosurgery who have dedicated expertise in skull base and spine surgery, who are also going to be joining the social workers in the breakout sessions. And then we're going to talk about sort of the pain management issues, of the rehabilitation issues, the insurance issues, and then we're going to finish up the day talking about sort of the latest and greatest in research. For any of your friends that weren't able to make it, we're live streaming this on YouTube. So this is the link in case you want to sort of tweet it out or send it out to them. And then a few sort of housekeeping items. First of all, the question cards that you guys were all given to check-in, use that to write down your questions for the Ask the Experts panel later on. You can certainly complete those cards and hand them in at the registration desk, or you can email it to the Chordoma Foundation Patient Navigator before that. And also, if you're active on Twitter, there's a Twitter link. And then, as I mentioned earlier, the conference is being live streamed. All the lectures are being video recorded, so they're going to be edited and they're going to be up on multiple websites and stuff a couple months for reference later on.